All right, welcome back. February is Heart Month, and we've been talking a lot about Go Red for Women this month. Heart disease is the #1 killer of women in Tennessee and the U.S., and today we have Dr. Loida Takogi, a cardiologist at St. Thomas Hospital, who's joining us with more on what women need to know. First of all, glad to have you with us. Thanks for coming.
Thank you very much for inviting.
This is a very important month. Let's first talk about, we know that this heart disease is the #1 killer of women. What are some of the numbers? What kind of statistics are we talking about?
It kills more than 480,000 a year in women.
More than 480,000 women each year. Wow. Let's talk about first, what are some of the things that we need to be doing? I know there are 6 ways you really recommend, 6 different things we can do to help prevent heart disease. So let's start with #1. And you say control your weight.
Control your weight. Eat fruits, vegetables, grains. Avoid salty foods, fried foods, foods high in fat.
Of course, that's easier said than done, but that's obviously
Exactly.
something that we need to be keeping in mind.
Right.
Now, the next step you say is exercise regularly. What do we describe regularly? Like, how often is that and how much as far as duration?
Like 3 to 4 times a week, 30 to 40 minutes each time.
All right, that's pretty demanding. But
Yes.
you say it is necessary to get these women into the gym or at least walking outside doing something physical.
Exactly.
Right? Okay, next you say if you drink moderately. Now, what is that? Like, how much is that?
That's like 1/2 to 1 glass a day.
Okay, no more than one
No more
glass
than
a day.
1 glass a day.
Don't smoke. We know that's obvious, but yet so many people still do it.
Yes.
And then finally you say control your stress.
Control your stress. Don't let stress control you.
Gotcha. Let's talk too about, let's say a woman's out there and they feel, or a man for that matter, but they feel some sort of pain and it's pretty severe. We're going to talk about the symptoms in a second, but how quickly do they need to be getting action? How quickly do they need to get help or go for treatment?
They should go to the nearest hospital or be transferred to a tertiary hospital within the first 90 minutes. And that is very crucial.
Within the first 90 minutes.
Yes.
I've often heard, too, my father-in-law has a lot of heart problems, that when something were to happen, to go ahead and take some sort of aspirin or something like that. Is that one of the better things to do?
Yes. If you think you're at risk, then take an aspirin once a day, especially among postmenopausal women. Because
that thins your blood.
Yes.
That helps with the clotting part. All right, well, let's talk, too, about what are some of the things that, you know, if we're experiencing, we need a red flag to be going off in our mind, saying this is something more serious, you know, that I need to get taken care of. So what are a few of the symptoms real quickly?
Symptoms are usually like an elephant sitting on your chest.
So massive pressure on the chest.
Pressure on your chest.
Okay.
Can be in the arms, can be in the neck, can be in the jaw.
Okay.
Then you can break out into a sweat.
Sweat.
You can get very nauseated, and some actually vomit.
Wow.
So,
okay. Nauseous.
and shortness
like
of breath.
Shortness of breath. All right. Key information for more info on preventing heart disease. You can go to the health section of our website. That's at WSMV.com and just look for Heart Month. So check it out. Look for Heart Month. It's a pleasure, Dr. Loida Takogi. We appreciate you coming by.
Thank you very much.
Thank you. Some life.